same. It says Someone Cares links the local church with hospital chaplaincy services to help provide emotional, practical and spiritual support to patients, their families and the wider hospital community.
Thank you. That was so wonderful to hear, those of you at Torch, just the work that you're doing in the community, linking faith and healthcare. And it's been really encouraging to hear of other things that are going on in the country within this space. And we feel really privileged to be part of that. So as Ross said, we are Someone Cares, and we are working to link local churches with healthcare services. This photo here is a photo of Alder Children's Hospital here in Liverpool, and this is where we started. To see if it moves on. There we go. So first of all, how Someone Cares began. It began back in 2018. It actually came out of a personal story, and that's the story of my family, actually. Our youngest child was born with quite complex health issues. We spent a lot of time in Alder when he was little, and just realised what a difficult and challenging experience that is. When you're on a difficult health journey, it has implications not just for the person who's sick, but for the wider family. And it was a really challenging, relentless and lonely and isolating place to be. I'm actually a qualified physiotherapist, so I have spent a lot of time in hospitals from the clinical side, and it was a real eye-opener to what that patient experience is actually like, and just the emotional challenges that come with that and how much support is actually needed. So off the back of that, the church that I attend, Freedom Church in Liverpool, approached the chaplaincy services at Alder Children's Hospital to ask whether there was any way that we could help support as a church the wonderful work that they were already doing within the hospital. And they really welcomed us with open arms, which was absolutely amazing. And we had the opportunity as a church, not just as individuals, but as a church, to support their services within Alder. Some of the ways that we've been involved over the years is we started actually with providing practical care. The hospital asked specifically for toiletry packs and children's pyjamas to be used in A&E for families who came in emergency situations. And within those items, we put flyers about spiritual care so that actually families were making contact with spiritual care at the point of admission rather than end of life, which is when we were finding that all the chaplains were finding that they were frequently being connected with families. So then they got to support families, and we got to support families throughout that entire admission and journey with them through it. Very soon we were asked whether we as a congregation could also provide volunteers to bolster their existing volunteers within chaplaincy. And over the years we've had many people from the congregation go in and become fully fledged Alder volunteers and work under the guidance of the chaplains within the hospital, which has been an amazing privilege for us and has also greatly increased the number of families that the chaplaincy team have been able to support within the hospital just by having more feet on the ground. We've also offered and provided support for one-off events, so things like Christmas events, Easter events. We put in a nativity treasure trail through the hospital that ended up in the chaplain, and people ended up in the chaplaincy department, and people came and at that point got given a gift and wrote down prayers and hung them on the tree and lovely things like that. But also that opportunity to meet specific needs as well within the hospital, such as maybe support with travel to and from the hospital for appointments for families who are struggling to afford that and things like that. The other thing is that within our congregation there is usually somebody who can meet a need that the chaplains have. So we had a graphic designer design a whole load of graphics for them for some posters and things they were doing, and then we actually had the congregation laminate well over 100 posters that they wanted to put on the back of all the toilet doors in the hospital, which again saved the chaplains valuable time so that they could spend that time working with families, and it gave people in our congregation a real opportunity to feel like they were contributing and helping towards what was going on in the hospital. And of course, prayer support is another real big thing that the whole congregation likes to provide. We've also been able to link families to further support both in hospital and upon discharge home. And it's wonderful to hear what Torch is doing, because I guess, you know, we're connecting with families within the hospital, and then outside the hospital after discharge, there's all these other things that are going on, isn't there? That it's great to see the local church supporting them in. But we've also had our church debt advice service, for example, go in and do debt advice with families at the bedside who are maybe facing financial challenges due to their child's prolonged ill health. So yeah, it's been a lovely thing to be part of. And through running this project, we became aware of a certain number of things, which will all be familiar things to yourselves, but were quite new to us and that we learned about as we go along. And I think one thing that's been really positive is coming to understand that the NHS is really recognising the need for pastoral, spiritual and religious care, and is moving. I would say that the NHS is moving towards rather than away from a model of biopsychosocial and spiritual care. We've really learnt about the value of healthcare chaplaincy and have seen the huge benefits of pastoral, spiritual and religious care within healthcare settings for those who are facing difficult health challenges. But one thing that we have also observed is just how overstretched the NHS is, and how overstretched healthcare chaplaincy services are as well. Really, when you think about healthcare chaplains, you may have a couple working employed within a large trust, and even with the volunteers that they have, really, they have an impossible task of providing the pastoral, spiritual and religious care for all the patients within that hospital, don't they? And we've also seen firsthand just how the local church community can make such a significant difference through working in partnership and supporting healthcare chaplaincy services to provide that care, and also as a result of that being able to support patients and families holistically, both during an admission but also upon discharge home. And it's also been really special and important for us as a church to support the chaplains themselves. They have such difficult roles, such challenging days, and actually just being able to give them the support that they need and to cheer them on in that and to pray for them has also been really, really special. One thing we started kind of thinking about was, like, how can we promote this role of the local church supporting healthcare chaplaincy? We've seen that be modelled, the church linking with chaplaincy in other areas, such as the prison fellowship, which is providing amazing support to prison chaplains all over the country. And why is that not happening in healthcare? I think some of the things that we maybe observed was, firstly, local churches don't necessarily understand or see that there is that need there within the hospitals. It's kind of designated as a role as an area of need that's met by the healthcare chaplains, and they don't necessarily appreciate that there is that need and that way that they can get involved and support. And I think most chaplains we have spoken to do have stories of volunteers coming in and things maybe getting a bit tricky at times. And I think there's many chaplains within healthcare who maybe have held support or volunteers slightly at arm's length, maybe been slightly hesitant, just a little bit anxious about what that support's going to look like and whether that's going to work within the context of the NHS. So I think there's been kind of challenges at both ends of that spectrum there. But moving on, having thought about all these things and learnt all these things, we went on to think about, well, what would it look like and how would we go about seeing what we're seeing in Liverpool replicated elsewhere in the country? And we formed Someone Cares UK to really focus on the growth and replication of what we were doing in Liverpool. This process has been absolutely wonderfully supported by an organisation called the Cinnamon Network, which supports social action from churches, and we became a registered charity in our own right in April 2025. Until that point, we were under the banner of Freedom Church. We are still relationally part of Freedom Church, but we became our own charity at that point. So the motivation and mission of Someone Cares, having gone through the background, this is really where our biblical motivation is from Psalm 147 verse 3, which says, "He heals the brokenhearted and he binds up their wounds." Now, we're motivated by our Christian faith, and this verse is really important to us. We all believe in a God who cares for the brokenhearted and those who are suffering, and we believe that as Christians we are called to care for and to walk alongside those around us who are going through difficult times. The heart of Someone Cares is to bring hope into hospitals, and we recognise that hope looks different for everybody. Healthcare chaplaincy is multi-faith, and as hope does look different for everyone, and we support those of all faiths, including no faith, and work within the context of what healthcare chaplaincy is within the NHS, motivated by our Christian faith, but there for all, and to provide hope for all. And as Ross read out, Someone Cares links the local church with healthcare chaplaincy services to help provide emotional, practical and spiritual support to patients, their families and the wider healthcare community. And we love to meet people where they're at, to work as part of the wider healthcare team to meet their needs and to support them in finding glimmers of hope in their own situations. And we are currently working towards churches supporting healthcare chaplaincy throughout the UK. We currently have projects running in Liverpool, which is our existing project, and we have a project starting at the Borders General Hospital, and we also are working with a healthcare setting in Leicester. So as you can see, it's early days for us. But we also have many other areas and chaplains and churches who are really interested in what we're doing, and we're aiming to build our foundations really, really well as we get going on this journey. So ways in which we are doing this and what does Someone Cares look like? There's a few different strands to what we're kind of realising is important. And firstly, that is promoting healthcare chaplaincy. Like I was saying earlier, we're finding that churches don't necessarily know what the need is in their area and the different ways that they can actually, as a church, get involved and support healthcare chaplaincy within the NHS. And we've been working hard at doing things like attending conferences. We were recently at the Chaplaincy Roadshow conference, and we've been doing some speaking at events and also trying to produce written articles. We did one recently for the Evangelical Idea magazine, which kind of told the story and really hopefully highlighted how churches can get involved in supporting healthcare chaplaincy. An important part of what we're doing is listening to chaplains. Again, like I touched on earlier, I feel like some of the chaplains we've spoken to can actually be understandably and quite rightly hesitant about who they give access to the hospital and to the patients and to the service that they provide. And off the back of that, we have learned that according to chaplains, they would like assistance in finding appropriate and sustained support from the local church community. It's really important that they have volunteers who understand what healthcare chaplaincy is before they come into the hospital. They've also said that what would be really helpful is training for volunteers, so that those volunteers, when they do arrive in the hospital, obviously they get local training as well from the hospital that they're going to be volunteering in, but actually good quality training for maybe healthcare chaplains who don't currently have volunteers on their team, and also just to make sure that volunteers know what's involved before they walk into the hospital is really important. So we've written a training programme for our Someone Cares volunteers, which meets the capabilities and competencies laid out by the Council of Professional Chaplains and Pastoral Carers. I struggled to say that because that's the brand new name for what was previously the UK Board of Healthcare Chaplains. And within this training, we really look at things such as the landscape of healthcare chaplaincy within the NHS, chaplaincy as a profession and all that involves, and also where does faith fit into this? How do we come in as Christians? How do we love those of all faiths, including no faith, who are on difficult faith journeys? What is it appropriate for us to share? And how do we really kind of articulate our own faith within that space? And as part of that, we also cover skills for chaplaincy, making sure that we help volunteers to deliver high quality pastoral, spiritual and religious care for all and what that looks like. And then we cover all those important professional skills too, like safeguarding, confidentiality, how to undertake reflective practice and CPD. And it's important to chaplains as well to have volunteers who are well supported in their roles so that they can continue within that role, because it is a difficult role. And also chaplains are appreciating the opportunity to share ideas and resources across different projects in different areas through the work that we're doing with our volunteers. And then we also are supporting churches who are interested in starting a local project. We'll help build supportive links between churches and healthcare chaplaincy, again, kind of answering some of those questions from both sides about what this could look like. And then we equip churches by providing support for the church and the project lead as they set up a project. providing training for new teams and volunteers, as I was saying. And then we also have ways to provide ongoing support, such as resources, reflective practice and CPD sessions for volunteers. Those exist in the country for healthcare chaplains, but currently not for volunteers, so we're looking at providing them. And also just online peer support sessions for project leads at different projects for networking, sharing of ideas and examples of service provision. So those are our 3 areas: promoting healthcare chaplaincy, listening to chaplains and making sure that we're meeting their needs, and then establishing and supporting local projects by churches. Just thought it'd be nice to kind of, I can tell you what we do, but actually it's really helpful to see the feedback, isn't it, and see what other people are saying about the work. So I've just got a couple of quotes for you. First of all, this is from our wonderful chaplains at Alder. The link with Freedom Church through Someone Cares has been an amazing blessing to our patients, families and staff alike. The practical benefits of care packs and children's pyjamas are so much needed and appreciated, whilst the spiritual and social benefits of prayer and visits from volunteers have enabled the work of the spiritual care team to reach out to service users and staff who might otherwise have slipped under our radar. I think that's a lovely summary of the work that we've been doing at Alder. And here's a quote from the spiritual care coordinator at the Borders General Hospital, where we've just started a project. She said, working in conjunction with Someone Cares and local faith groups in our community has brought a more collaborative approach to how we serve spiritual care in NHS Borders. From creating patient support packs for both the emergency department and the Department of Care for the Elderly, to setting up an interactive tree throughout the Easter period with which patients, staff and families have been interacting with. We are very excited to see where our collaboration takes us next. And then here's a little quote from a family who we supported. We just wanted to say thank you for all your support and prayers. You have helped us find faith, hope and peace at the worst time in our lives and when we truly needed it. Please thank everyone in church for their prayers. They have helped get our baby home. And that was a lovely piece of feedback for us to receive as a team.